learners. This is Dr. Ruchika Kuba, Director School of Health Sciences and your course coordinator for this course on lifestyle and non-communicable diseases. You have already learnt about the different non-communicable diseases and their risk factors and their impact on health. Let us now talk about an important non-communicable disease which is called chronic obstructive pulmonary disease. We have with us Dr. Rupali Malik, Professor, Department of Medicine, Vardhaman Mahavir Medical College and Safdarjung Hospital, to tell us more about the strategies for prevention of this condition. Welcome, Dr. Rupali. So, what are the learning objectives that you have planned for today's session?
Thank you so much, ma'am, for inviting me for this important session on chronic obstructive pulmonary diseases. Now, the learning objective for today's session would include defining COPD and its burden, describing the common symptoms of this disease and its risk factors, to discuss the lifestyle changes recommended for COPD patients, and to discuss the strategies for its awareness and prevention.
Okay, so now COPD is a term which is not very easily understood by common people. And so, what is this chronic obstructive pulmonary disease? If you could tell us more in detail.
So, COPD, the term stands for chronic obstructive pulmonary disease. So, as the name suggests, it is a chronic disease, which means it is a long standing and a progressive lung disease which would lead to obstruction of airflow in our respiratory tract, and that would ultimately lead to breathing problems. And if we talk of medically, there are two subtypes of this disease which are known as chronic bronchitis and emphysema. In bronchitis, there is inflammation of the airways which is associated with mucus production. So, the patient will have complaints of cough with expectoration. Whereas, yes, mucus is produced. Whereas, in emphysema, there is damage of the alveolar walls which can then lead to defective oxygenation in the lungs. So, these are the two common subtypes which are often used against this term. So, sometimes patient may not know of COPD, they may know of bronchitis or emphysema. So, emphysema, chronic bronchitis, they are all subtypes of this broad term known as chronic obstructive pulmonary disease.
So, why should we consider the COPD or chronic obstructive pulmonary disease as an important NCD which you would want to discuss today?
Yes. So, COPD is one of the most important or one of the very important non-communicable disease, because first and foremost it is not a curable disease like most other non-communicable diseases, but it is among the leading causes of death. After cardiovascular diseases in present times, next comes the respiratory illnesses, of which COPD is one major one. And if we talk of the global prevalence of this disease, it is around 10.3%, which means out of every 100 people, 10 would be having COPD. So, this is a very, very large number. So, out of every 100 people that we meet, 10 people would be suffering from this chronic obstructive pulmonary disease. And more than 90% of these patients of COPD, they are from the low and the middle income country like ours, and India has the highest number of COPD cases in the world. So, this makes it even more important for us to understand this disease, as we have the maximum burden of the disease in the world. And the burden is further projected to increase because of the continued exposure of our population to the risk factors and also the aging of our population. As the longevity is increasing, the aging is being more and more often seen.
This is a very important thing that you have told, because this means that so many people that we come across in the public who are coughing and who are having breathing problems are not actually infected. They are suffering from a non-communicable or a non-infectious disease. So, but they, as you said, it is not curable, so they do require some kind of a treatment. Now, how does a person who may be suffering from this disease actually present, or what are the symptoms that we can think that okay, he may be suffering from a COPD disease?
Okay. So, the common symptoms with which a patient having COPD would come to you are cough, which may occasionally be associated with sputum or some productive cough, and it is also often associated with shortness of breath or dyspnea, then wheezing. Okay, there is whistling sound while the patient is breathing, which indicates that there is some obstruction or the spasm going on in the respiratory tract, which is often seen in asthma also. Then they can have chest tightness, they can have fatigue. Okay, now all these symptoms when we talk of, they are very non-specific. This is something we all need to understand.
Okay, but then you mentioned something as asthma. Now, how is COPD then different from asthma or just flu infection? Even in the flu, we have a lot of cough, breathing difficulty because there is so much of expectoration or so much mucus production. So, how will you distinguish these conditions from COPD?
Yes, so this is something very important for the lay people to understand. So when we talk of COPD, all these signs and symptoms, they are non-specific, which means not only COPD, the other respiratory disorders can also have similar sign and symptoms. So for example, asthma, which is again a very common respiratory illness. Now asthma, when we talk of, it is classically a disease of childhood and is considered a reversible disease. It is a reversible inflammation of the respiratory tract. So whenever there is a trigger, it is an allergic condition, there is hyperresponsiveness of the airways. So whenever that allergen is there, the airways would have hyperresponsiveness, there would be edema that would lead to bronchospasm and symptoms would be there. So it will be kind of episodic.
In short, you are telling that it will cause a lot of breathing problems.
Yes.
There is swelling inside.
Yes, yes, but that is reversible. This is one thing which is very important. So in asthma, the inflammation is reversible. So when there is an exposure to the allergen, you will have these symptoms, but when the offending agent goes away, you will have relief of symptoms. So it is usually associated with the exposure and it usually starts with early childhood. Okay? So usually early in your life you will start having such symptoms. So that is what is asthma. But on the other hand, COPD, which also has similar symptoms, but it is classically a disease of the older individuals. Okay? Later in your life you will have COPD and sometimes asthma can itself go on to become COPD. So sometimes patient can have both, which is known as ACOS, the asthma COPD overlap syndrome. So sometimes patient can have both, but in gross terminologies, if we talk of, asthma is a disease of childhood and reversible, whereas COPD is in the older individuals and irreversible. So the changes that we have in COPD in the lung are irreversible. So this is another major difference between COPD and asthma. So these patients will keep on having symptoms throughout, not like patients of asthma who will only have it when they are exposed to the exposure or the allergen. But COPD patients, irrespective of that, will also have persistent symptoms. Now similarly, when we talk of the flu infections or the viral infections which commonly affect the respiratory tract, now they also have symptoms like cough, shortness of breath or wheezing, tightness, anything. But again, since it is a viral infection, there prominently the patient will have fever first. So fever will be there to begin with, and those conditions, since it is a viral infection mostly, it will be limited in their disease course. They usually have a duration of only 5 to 7 days, unlike patients of COPD who will have these symptoms throughout the year. Okay? So that is one very important. So disease duration makes a difference. So if you have a chronic cough more than 2 weeks, then you need to be careful about, and usually in these patients at least 3 months. COPD, they should have at least history of 3 months of symptoms. Now there are various health concerns which these COPD patients have, which are beyond their respiratory problems. So not only the respiratory problems they will have, they will also be at a higher risk of developing several other problems like heart disease. They will have things like depression, anxiety, weak muscles, brittle bones, osteoporosis. So all these problems are also more often seen in COPD patients compared to the general population, and also they will have higher risk of lung infections, flu, pneumonia compared to the normal individuals, and also higher risk of lung cancers.
Okay, so we have understood a lot about this disease. Now, are there some people who are more likely to get this disease? How do I know whether I am more likely to get this disease, maybe a little later in life?
So there are of course some people who are more likely to develop this disease compared to the other individuals, because there are certain risk factors, and the most important risk factor is smoking. So tobacco exposure is the most important risk factor for development of COPD. It can be active smoking, and even passive exposure to second hand smoke in the house or anywhere else is also equally important. So, tobacco exposure is one such thing. Then even exposure to the environmental pollutants, which can be because of some occupational exposure, or which could be because of even indoor air pollution, like use of the biomass fuels in the house, the burning of coal and the other crop residues, etc. All these things will also predispose the patient to develop COPD. So, first is the tobacco, followed by the environmental pollutants indoor as well as outdoor, and then is the genetic predisposition. So, conditions like alpha 1 antitrypsin deficiency, which is a genetic disorder, would predispose individual to develop one of the subsets of COPD, which is emphysema, where the alveolar walls will get damaged. So, genetic predisposition, and lastly recurrent respiratory tract infections. So, all these 4 things would predispose an individual to develop COPD.
So, like you said, most of these are environment factors, but you can also get it through inheritance. That is, if there is somebody in your family, then because of certain genes, you can also be more, more chances of developing this disease.
Absolutely.
Now, so someone develops this disease. How is their life affected because of this disease, and can he adopt certain lifestyle measures so that it can help them?
Yes, of course. Now, as we all understand now that the disease would lead to respiratory difficulty and the breathing problems. So, as the disease would progress, it would become very difficult for these people to carry out the normal activities due to the breathlessness. And this would ultimately lead to considerable financial and social burden, because they will have limitation of their productivity at workplace, their productivity at home, and also they will have to bear the additional cost of the medical treatment. So, ultimately they will be under a huge burden.
So, how can you change your lifestyle to adopt if you have already got this disease?
Yeah. So, other than the medical management, which would be provided in the form of inhalers by the doctors, or some oxygen therapy, sometimes the long term oxygen therapy at home might also be needed. But in addition to these medical management modalities, what considerably help these patients is the lifestyle changes. It will improve their symptoms, and it is very important for the patient to understand that these things would definitely make their life much easier. Now, and out of this, the most important thing is quit smoking or vaping. So, this we have discussed enough. So, smoking, tobacco exposure is the most important risk factor. So, even if you have been smoking for many years, quitting will still help and will prevent the progression of disease further. You also have to avoid the second hand smoke or smoke from the indoor or the outdoor, whatever is there, exposures are there. Then breathing exercises are again important, and to stay physically active, that will increase your again the lung capacity and other things. So, that is again very important. Following a healthy diet is something very important, and last but not the least, to take all kinds of preventive vaccines.
Okay, so you've talked about quitting smoking. Now, how it's very easy to say that just stop smoking. People have been chain smokers, as you yourself said. There could be people who have been smoking since a number of years. Just by saying quit smoking doesn't really help, and it's not that easy. How can you suggest such people, how can they address this problem?
Now, so since we all now understand that smoking cessation, which is the most important component, is often not easy to do. So, it is often easier said than done, and the most important thing is that the patient should be very determined about quitting smoking. And one very important aspect of that is to take help of the support groups. So, various support groups through the NGOs have been made, which usually help these patients quit smoking, and if not, then you will have to go to a medical professional. The medical professionals would also give you proper counseling, behavioral therapy, followed by some medical help or the pharmacological therapy if needed. The pharmacological therapy can also be in various forms, the nicotine replacement, the non-nicotine replacement. But before that, the most important is to be educated enough to stop smoking.
Okay. Now, as you also mentioned, along with smoking, that there are certain external pollutants which can also contribute to the development of COPD, and those who have it can worsen their situation. Now, at an individual level, we understand that this needs to be addressed at a country level or at a state level or even at a community level. But at an individual level, how can a person protect himself from these external pollutants?
So yes, so this is again very important that we have to avoid exposure to pollutants to prevent us from developing this kind of a disease and also the worsening of the situation. Now the most important thing that we can do is at home we have to maintain a good air quality, because most of our time we are going to spend at home. So at least when we are home we should have a good air quality. For this we can use air filters, and we have to reduce the indoor smoking. We have to avoid usage of the biomass fuels at home. So coal burning, the wood burning and all these things, so they should be avoided. So all these things can be done, and if at all you have to move out of the house, you can wear mask in the polluted environment. That is how you can help yourself.
Okay. So, what other interventions will help the individual if he is having COPD or to protect himself from COPD?
Yes, so after avoiding the pollutants and stopping the cigarette smoking, the next important thing is the regular exercise. So exercises, they have shown to have beneficial effect on the lung functions as well as the overall health of these individuals. And what is recommended is to do things like walking and also the breathing exercises like pranayama. So you have to focus a lot on such things, because overall if you are active, the lung health would also improve. And the next thing comes the healthy diet. So it is very important to have a nutritious diet, to be hydrated, and also we have to encourage use of food products which will have good effect on the lung health, especially things which contain high amounts of the omega-3, which are present in fish oil, some plant oils, the nuts, and we also have to have fresh fruits and vegetables in our diet. So all these healthy food items we should regularly consume.
Is there any role of vaccines? You mentioned earlier that vaccines are important.
Yes. So again, this is one of the most important aspects of the healthcare in COPD patients, to take preventive vaccines, because as I mentioned previously also, that lung infections are also a factor which would lead to progression of the disease, development of disease. So flares of the disease are related to usually infections. So we actually have to prevent these infections in these patients. And the most important or the common vaccines which they should be taking are the flu vaccines, which should be taken every year depending on the strains going around. The pneumococcal vaccine should also be taken as per the recommendations, and whatever COVID-19 vaccines are available, all COPD patients must have them, and also their latest boosters if available.
We now understand that this disease is not curable, as you mentioned. So, can the community also help? Are there some community strategies that you would suggest?
Yes, of course. Now, community has a big role to play. Now, we should encourage public awareness campaigns so that people are aware about this disease, the risk factors, and how promoting smoking cessation and healthy lifestyles would help or prevent development of this disease, because we cannot cure it. So, the best way is to prevent it. And even at the policy level, at the government level, we should advocate the policy changes for adoption of clean air regulations. We have to support the tobacco control policies also in our country.
Like even we had the phasing out of the diesel vehicles and
Yes.
stringent control about the pollution from the vehicles.
And also we have to provide better access to the health care. So even the underserved areas should have better resources, and they should have regular health screening, so that if at all they develop the disease, they are diagnosed at an early stage and are managed better. And then various community activities like exercise groups, health workshops should regularly be organized, so that and also support groups should be formed for individuals who have already developed the disease and their families. So you should have some support groups for these people.
Now, are there any directions at international level also for this particular disease?
Yes. Now WHO has taken various initiatives to prevent tobacco usage and to decrease the tobacco exposure, and one of the most important of them is Empower. which includes components like monitoring tobacco use and prevention policies, to protect people from tobacco smoke, to offer help for quitting tobacco use, and to warn people about the dangers of tobacco, to enforce bans on tobacco advertising, promotion and sponsorship, and to raise taxes on tobacco. So now even the Indian government is collaborating with WHO. There were various smoking cessation centers which were launched in 2001 and 2 in collaboration with WHO. There was a chain of such centers made in our country, and also the government is also a part of this Empower initiative. And also the WHO has also suggested things like the clean household energy solutions. So under this program there are various modules which tells us about what are the various ways in which we can see how much emission is being made in a household, what are the ways in which we can prevent those emissions, and so such solutions are also available.
What do you think will be the best way to implement these preventive strategies at the ground level?
Yes. So the most important would be a collaboration between the local healthcare providers, the schools, the organization and the local government and the policy makers. So all of them have to collaborate together to spread awareness about this disease so that we can prevent it before its development. And even when the disease has developed, we have to have a multidisciplinary approach which involves not only the physicians but also the respiratory physicians, the dietitians, the fitness experts, the social workers, all of them. So for prevention as well as for management, we require a multidisciplinary approach.
So we have understood today that COPD is not curable, and also that preventive strategy is the key, so that this disease should not occur. What are the other take home messages that you would like to share?
Just mentioned, since it is not a curable disease, the prevention is the key, and reducing tobacco exposure is the most important for both primary prevention as well as for the disease management. So that is one thing I would like to emphasize most upon, and also we have to ensure advocating clean air regulations, adopting clean household energy usage, and the local and at the national levels also we have to have the inclusion of the government, and preventive vaccines. This is something very important which cannot be undermined, the importance of preventive vaccines, and last but not the least, the healthy lifestyle, the exercises and a healthy diet, nutrition is very, very important.
Thank you very much, Dr. Rupali. I think we have had a very interactive session and a very important session, and I think we have a lot of take home messages. We have to work at individual level, we have to work at community level to be able to combat this disease right in the bud, so that it does not become a problem. Thank you very much.
Thank you so much, ma'am. Thank you. So I would also like to share with you all a story of my patient Ramesh, who had recently visited us. He is 70 years old and he had come to us with complaints of exertional dyspnea or shortness of breath for past 6 months. To begin with, he thought he is having shortness of breath because of the old age, but progressively the breathlessness increased, and for past 3 months he also started having complaints of cough and expectoration. To begin with, it was a dry cough, but past 10 to 15 days he also started developing some expectoration along with that. Mucus. Now we did some checkups on him and we asked him if he had any history of any allergy in the childhood or any recurrent infections or any tubercular or any other lung infection in the past. He denied any of those. He did not have any history of any other comorbidities also, any heart disease or any other disease which could contribute to his breathlessness, that also he denied.
Problem in breathing?
Yes, he had a lot of problem which he thought is just a part of the aging, but when we did the investigation, especially the pulmonary function test, we found that he had an obstructive lung disease. So once the patient was diagnosed, now we had to look for some risk factors if he already had any, because he denied of any history of allergy in the past, any other comorbidities, but he had been smoking significantly. He had been smoking daily around 10 cigarettes per day for past 10 years, so which was a significant tobacco exposure. Now the first thing that we motivated him was to quit smoking. It was difficult to begin with, but ultimately we made him convinced about his disease and the future complications if he do not quit smoking, and we also suggested him to go to some support groups, because support groups help these patients get motivated even better. So after that, after like 3 months of the smoking cessation, he felt considerable relief in his symptoms, and that kept him going with the smoking cessation. And along with that, we also gave him all the preventive vaccines, the flu vaccine, the pneumococcal vaccine, and also the latest COVID-19 vaccines. And along with that, we also encouraged him to have the healthy diet, like which has fruits, vegetables, nuts, because he was a vegetarian, he could not have fish, but we told him to have enough nuts in his food, and all these things ultimately helped him better, and also to do regular exercises.
That's really encouraging, and I think just like your patient, if there are other people, they can also benefit with all these strategies, and I think they must go in for that.